Most of the chemotherapy side effects in treating pancreatic cancer are very similar to the types of side effects we see with other cancer treatments. So nausea and vomiting certainly is one that people ask about. It's occasionally a problem, but not as much as years ago. We have so many effective different classes of anti-nausea medications now that we usually can control it very effectively, although some people do have a low-level nausea that persists. Diarrhea is frequent with some of the regimens that we treat very aggressively, either with Imodium or a prescription medication. Paradoxically, some people have constipation, primarily because of either pain medications, narcotic, analgesic pain medications, or even some of the anti-nausea medications can cause constipation. Hair loss is not that common. There are some regimens where, some drugs where hair loss is expected. It is reversible, it does come back. I usually tell people they'll come back as an I Love Lucy redhead. But hair loss is not a universal phenomenon, and with many of the treatments, they don't lose their hair. It might thin so that only they would notice it, but it really isn't as much of a problem as you might think. All of these drugs, all of these regimens can lower the blood counts, and again, it's something that isn't a serious problem in pancreatic cancer. We usually don't get into problems with overwhelming infections because of low white blood counts or bleeding because of low platelet counts. It's usually not a problem. The one issue that we do deal with quite a bit in pancreatic cancer is a cumulative neuropathy, so that it's numbness, tingling, pins and needles of the fingertips, sometimes numbness in the feet. It's a side effect of two of the drugs that we use in pancreatic cancer, and we ask about that at every clinic visit. Sometimes we need to adjust the dose of one of the medications. Sometimes we'll omit that medication, and we may come back to it later after the neuropathy improves. Usually the neuropathy is reversible, at least to some extent, and often completely.